Welcome to this podcast from the European Society of Anaesthesia and Intensive Care. Today we have the special pleasure to broadcast from the EU Anaesthesia Congress in Glasgow. I'm your host, Alexandra Trinks. I'm from the LMU Hospital in Munich. And with me is Dr Matthew Davies from the UK. He's the president of the Association of Anaesthetists, and he works close to Birmingham in a small hospital, which you can probably explain better to us.
Yes, thanks. It's about an hour away from Birmingham. I work in Peterborough Hospital, just in North West Anglia NHS Trust, so just in the east of England.
So today we will be talking about well-being in anaesthesia and intensive care. And so let's start with what's the situation today? What's your opinion on the well-being of our society?
Yeah, well, I think this is the concern, isn't it? I mean, I think, anaesthesia and intensive care as specialists over the last sort of 2 or 3 years, I think we've all gone through a very difficult time, really in response to what has been a sort of, the pandemic, and that has led to huge work intensity, huge pressure on anaesthetists and intensivists to deliver on what have been extremely extreme and difficult circumstances. So I think we had a growing problem of an increasing well-being issue leading up to the pandemic, but what's happened over the last 2 years has really accelerated that problem, and we're seeing the effects of a significant number of our colleagues and specialists sort of really suffering the effects of that work intensity.
Yeah. So what we often call it is fatigue. And there have been several studies performed concerning fatigue in trainees and consultants in anesthesia. So as far as I know, there are over 70% of our colleagues say that they have concerns about their fatigue. What's your opinion on that?
Yeah, I mean, I think you're right. I mean, I think that's a very large proportion, isn't it? And actually, the problem all starts with fatigue, doesn't it? I mean, it's a scale, and I think there's no doubt that everybody is feeling a little bit fatigued, and a lot of people are feeling fatigued to the point where it's really starting to affect the way they perform at work, their ability to recover, and there have been many sort of pieces of work that have looked at the incidence of fatigue amongst trainees, amongst specialist doctors, amongst consultants, and the effect of nighttime work, all really showing that the level of fatigue is rising.
Yeah. So what are your thoughts about nighttime work? Because that's one of the big topics in fatigue concerning hours of shifts, how long people work. In Europe, many trainees still have 24-hour shifts, which are a big problem for being fatigued afterwards. Yeah,
no, I mean, I think it is what makes people tired. It's one of the huge factors that working both long hours and at hours where our body isn't supposed to be awake is the problem with nighttime working. And I think it's become plainly obvious for me, talking to a lot of colleagues here at the European Society, that in the UK we have quite strict ways of where the trainees and consultants can work in terms of hours of shifts, but that is not what is happening across the continent. And I think there are a lot of people working long shifts without breaks, and then are expected to go home, drive a car, do things that really they shouldn't be doing after such a long period. And I think we've, in our work that we've done looking at trainees particularly, and then following consultants, where we're limited to 13 continuous hours of work, even that has shown I say even that, I mean, for me it's still a long period of time, working 13 hours in a row. And I think there's clear demonstrable evidence of both a drop-off on performance, an inability to be compassionate at 5 o'clock in the morning after you've worked for such a long period of time. You get what is known as compassion fatigue, and then the ability to get yourself home after a night shift is clearly affected. And sadly, we've seen the tragic event of trainees who've died driving home in this country following their night shifts. It just should not happen. Yeah,
I read some interesting numbers that close to 40% of trainees reported having a near miss or accident when driving home, and even more consultants, probably as they are older, incidents rises. So 45% of consultants notes that they already were close to having an accident or even had one. So I think it really is a big problem if you think that's close to every second one of our colleagues.
Yeah, no, and I think we did. I think the Fight Fatigue group, which was originated, I think, in 2015 in the UK, really did quite an interesting piece of work where they took a trainee who'd worked 13 hours and they took them down to an advanced driving school and sat them in a driving simulator and recorded their what would be a typical for them 60-minute drive home, and they actually showed how many times they veered out of the lane, had micro sleeps of up to 5 seconds at a time, which only takes one of those and one drift into another lane at the wrong time and potential catastrophe. So this is not a theory, this is fact, that people are putting themselves at danger every time if they're fatigued and driving home.
So because I think every one of us will understand the problem when coming out of the hospital after a shift, that you want to get home quickly and maybe it's not possible to take a train, or it takes you much longer. So what can we do when seeing a colleague who's clearly fatigued?
Yeah, it is really, I know myself, and as you just described, you want to get back, you want to get to bed, because you may have another night shift coming up in the next 12 hours. I mean, I think the important thing is you can't force people to go and have a rest. So that you can't be like, there's a bed, lie down, go sleep. It doesn't work like that. But I think we have to be more open about talking about it. And certainly one of the things that we've brought in regularly in some of our practice in my hospital, but also in other hospitals, is to have that check-in in the morning. You're checking in to see what's happened overnight, to make sure no catastrophes have happened overnight, people haven't suffered something significant that needs to be talked about. But also once the handover's done, it's like, right, you okay? You're okay? How long have you got to go home? Well, fancy a cup of coffee and let's talk about this. Or if you don't want, do you want to go and lie down, and we provide an appropriate, quiet, dark room that people can go and have a sleep, where it's not outside theatres and there's orthopedic surgeons hammering right next to you, keeping you awake. So it's just about talking about and giving people the opportunity. And people don't take you up on the offer all the time, but actually it's surprising how many people are now saying to me, thanks, that's great, I'll just go and have 2 hours, and then you see them 2 hours later, they look different and they go home. And I think it's not attaching a stigma to it and making people feel guilty for wanting to do that. It's just really important, and to give them the opportunity to feel that they can do it.
It's a psychological effect as well, because if you had a horrible shift and someone asks you, how are you, before going home, I think it makes something with the people's well-being as well.
Oh, and that is part, and it is part of well-being. It's just you don't want people to take home what's happened overnight and stew on it and not have the ability to talk about it. Because people are working whatever environment, in anaesthesia, perioperative care, obstetrics, ICU. There will be nights which you just need to talk about and begin to process what's happened. And it just from a well-being perspective, it doesn't then sit stewing till the next time you come in and you've wondered what you've done wrong or what I didn't do at the time. And just having an open conversation and giving people an airspace to say stuff that they want to do and be honest about it, I think is really important.
Yeah, so maybe this is one important message of this podcast, to maybe have a short break in your daily routine, think about yourself, think about your colleague, and take out the speed and have a short moment for watching out for yourselves.
Yeah, no, and it is as simple, isn't it? That we all know that there are many lists that go on all day. A single anaesthetist who doesn't get a break, doesn't get any food, doesn't even get the opportunity to go to the toilet, which is just it's just cruel, isn't it? Really. So I think it's being aware of what's going on, and that's part of being maybe a leader in a department or someone who takes a more senior role, who has an oversight of what's going on, and recognising that someone's either struggling or in difficulty, or is just in need of half an hour, and then they can make that happen during the day and make sure they've eaten, they've drunk, they've had a break, and their brain is refreshed, ready for the rest of the day. So it sounds simple, but it's amazing how many times it doesn't happen.
Yeah. So maybe let's talk about what can people do, what kind of resources are there if they are worried about their self, about their department, about their colleagues. What can we do?
So there's I look at this in two distinct ways. So there's the individual, what you can do for yourself, but there's also changes you can start to make within your environment that you work. And I think they're both very important. I think there's only so much you can do as an individual before the system that you work within or the environment you work within has to change for you to basically ease the pressure on you as an individual. But certainly there are lots of resources out there that are available in terms of, as an individual, if for example, on what we have a section on a landing page on our website that allows people that if they think they immediately need some help, they need to speak to somebody, something really there's some contacts there that I can go straight to and speak to. And then there's the sort of how can I manage my own fatigue? Firstly, recognizing that it's a problem, recognizing what I can do about it. Simple things like you've already mentioned, about having the break, having a moment, having the ability, caffeinated, all of those things that are there. Again, not difficult things to do, but also just as an individual, you can begin to manage your own fatigue. And part of that is, if you're working at night with 3 or 4 other trainees or 3 or 4 other consultants, sit down and say, right, let's make sure we all get a break. Let's make sure I'll carry your bleep for an hour while you have a bit of time off. And if the work allows it, you just make sure that there is that sort of, because you're in it together at night, aren't you? And you're a team. You're not just an individual. So I think when you're on a night shift with a good team, because people will be looking out for each other. They'll pop in and say, right, it's time for you to go off and I'll carry your bleep, or I'm going to have a lie down. I'm absolutely what we would call is very tired in this young country. I was going to say something else then, but I won't. And looking out and just looking out for each other, because if you look out for each other, someone's looking out for you. And I think anaesthesia is very good at that. We're one of the better specialties going forward, and I think because we're more willing to talk about it, and actually we're just a bit more willing to maybe ask for it.
And maybe show that we are not perfect ourselves.
No, and to me, I'm not that impressed if someone works 13 hours and says how untired I am. That borders on a lack of insight into human physiology, because nobody can work 13 hours overnight and feel fine. So there are fact sheets from the Association of Anaesthetists. You can just download them. Absolutely. And I think what's been really good for me to be here and speak to my colleagues across Europe is actually there are lots of pieces of good work going on in lots of different countries, and actually collaboration and sharing the resources that people have put a lot of hours and a lot of work in around these topics is what we should be doing. And and if we find some good piece of work done somewhere, we should bring it to our department and go, look, this is what we're doing in Germany, and this is really, really good, and we should be doing this because actually this is the benefit. And equally so, if we've done so, we're very, very happy to collaborate and share our resources for what the pieces of work that we've done. And absolutely.
So everybody can check out the website. There's even an app from the Association of Anaesthetists. You can download it and.
There is, absolutely, and but certainly all of the fatigue and rest facility. I would say they're posters. You can download them as A4 poster size, and what we encouraged in the UK was everyone download them and just put them up in the department, because actually people just walk by and have a look at it, and then actually we found surgeons were looking at it, we found paediatricians were looking at it and going, what's this all about? And actually we say, well, this is all about this, and you can say, well, that sounds like a good idea, and actually then it starts to disseminate outside of your own specialty. And then when you're on night shift, everybody's speaking if you're up with a sick kid with a paediatrician, you can make sure everyone's all right, and you're looking after each other in the hospital. So I think anaesthesia has sort of led the way in some of these these initiatives, and I think we've had a lot of buy-in from our other colleagues.
And those sheets are graphically very nicely designed, so you can just have a quick read. It's not a big paper, it's just easy messages. They are with different colors, and you can just put it in front of your locker, and everybody who passes by wanting to drive home can just read if he's able to drive, or if he maybe should have a little rest, or put it in the room where you have a little lunch on midday, and people will maybe talk about it. So little things that might start the spark of this change.
And I think we've got on our department on the way out a sort of one sort of slightly big one that says just check in, and it gives 5 very simple boxes, 5 0 questions before you go home. Are you? And before even as you're walking out the door, it might just go, oh, actually, no, I'm not. Actually, I need to do this before I go. And it's just it's little nudges and little suggestions that allow the individual to sort of recognise and get insight into how they're feeling is really important.
And if you're from another country, those fact sheets, you could translate them yourselves, or the European Safety Patient Foundation, they started translating those sheets, so you can download them at some point. So it's you can also start contributing if you like.
Absolutely. And just being at the meet, there are some fantastic pieces of work going on from the patient safety initiatives from the European societies, looking at just again which is why it's really important that we all collaborate so that we all share our sort of knowledge and resources, really.
Yeah. So maybe if someone thinks about well-being and is interested in that topic, how did you start this? Because you probably didn't think about it in the beginning of your training as well, or maybe you did.
No, I didn't, and I think this is what happens is that something bad happens, doesn't it? It makes you think about it. I spent 19 years in the Royal Air Force in this country, and I spent and actually, in a way, that started. We often refer and compare to the aviation world in terms of safety, and part of my training was about crew resource, and actually managing how people don't fly an aircraft when they're too tired. And actually it made me start to think about how we managed. I used to work in very small teams of 4, used to do about a long flights, and it was how you manage the fatigue in that. And then, so that started my sort of proactive, this is a good thing that we should start looking. And then I had a sort of very tragic event on ICU that a system failed a patient, and bad stuff happened. And I think it made me start to the effect that had on me as an individual clinician, and the team that were also involved, and how we felt powerless because nothing that we had done had failed, but the system had failed, and we felt personally responsible. And that led to this concept of harm that's just not happened to the patient, but it happens to healthcare staff. And actually that is going to happen, but then how we manage that was very sadly lacking, and it's multifactorial how you manage it afterwards. But it was lacking, and it made me think about how we should be doing this better for our teams, because by that stage I was a relatively experienced consultant. But this could happen to someone who's 3 years into their training, 3 years into their job, and the impact on them may be greater than me because of the experience I had behind me. So I think it just made me think that the resource of our staff and our clinicians need to be looked after when these things happen.
Yeah, I think that's an important message. So maybe we can draw some conclusions out of our little chat. So what do you think? What should people take home?
I mean, firstly, like any problem, it's admitting there's a problem, isn't it? There's a problem. So we need to do something about it. So there's things you can do as an individual about how you manage the way you work and how you work at night. But actually more so, I think, is a growing momentum to change a department or a system that we worked in, to recognise that primarily this is all about making sure we have safe care for patients. And tired, fatigued doctors do not provide as safer care as if you're well rested and looked after during that time. So recognising that it's not just about resting, it's about a resting well doctor provides safer patient care. And actually that's what we're all about, is we want to make sure the care for our patients is as safe as possible. And if we don't look after ourselves and look after each other and look after the team delivering that care, then we are probably letting our patients down. So actually it's coming at it from that side, saying, well, I need to improve patient safety. To do that, I need to improve the working conditions and my own well-being and my team's well-being and my team's ability to deliver when it needs to most. So I think there's an individual behaviour thing, there's a system change we have to do, but actually we just need to talk to each other. We need to share, we need to collaborate, and we just need to build a momentum. Yeah,
I think well-being is not just about your personal well-being and feeling good, but it's about patient safety. Yeah. It's also about a sustainable workforce, because if there are many burnouts in our society, we will have less anaesthetists who can take care of the patients. So the society, the European Society of Anaesthesia and Intensive Care, will provide some guidelines as well about sustainability and about well-being, because it's a topic that affects many disciplines and many areas of work.
Yeah, and because what we want people to have a healthy workplace, a healthy work life, have a full career in anaesthesia or intensive care, and deliver healthcare for as long as they feel they're able to, really. But if we don't look after people, people will leave the specialty, they'll stop providing healthcare, and then ultimately that's bad for the individual, it's bad for healthcare, and it's bad for patients.
Yeah, I think those are good words to end this podcast. So thank you very much for this nice chat, Dr. Davies, and thank you everybody for listening to us.
Thank you very much, and thanks, Alexandra. Thank you.
So there are many podcasts to listen to from the ESAIC. You can just check them out at the different podcast streaming platforms, and see you next time again. Bye bye and stay healthy.
Thank you. Bye.